Sarah.
I'm
Nice to see you again.
Yeah, nice to see you again too. Thank you so much for giving us your time again. And we were just talking before we started. You're in Toronto. You're in Canada. I had no idea. That's where I'm from. So that's awesome. Yeah, we should have got together when I was there a few weeks ago.
Well, next time when you visit your family. I
That's
live in this beautiful old building. It was the first medical school for women in Ontario.
You're kidding.
No.
Wow. How cool is that? Yeah,
It's
that's
beautiful.
awesome.
I'm in the surgery.
Oh my goodness. How fitting, hey?
Yeah, yeah.
Fantastic. Love it. So I love that we share that connection with Toronto. Very cool. Everyone's in the States these days. So it's nice to have a fellow Canadian.
Yeah,
Yeah.
so pretty much I'm from the States and most of my clients are in the States.
Yeah.
It's easier to access things in the States than
I
it is.
agree.
It's heartbreaking actually here.
Oh, yes. Canada's very tricky. It's probably the trickiest because most of my clients are in the States too. And I love helping all women, obviously, but I tend to prefer that because, like you said, there's so much more available to us there. Canada is definitely the most tricky out of all the countries. Australia, the US, the UK, I find Canada to be the most tricky to get around with supplements, like blood work. You don't have private labs. Yeah.
I know, no private labs, no consumer direct.
Yeah.
And I ordered for myself with the help of a nurse practitioner here, my wish list lab.
Yeah.
And so I got it.
Yeah.
But then they refused to test some of the things.
I know, because that's what happens to my Canadian clients. They just refuse.
I know.
See, I'm very lucky. I can write my own requisitions for bloods. I just went in a couple of days ago and I just wrote down whatever I wanted. There's never any pushback, nothing. I mean, I pay for it,
Yeah.
but yeah, Canada, it's just people think that the US has a medical problem, but Canada has a bigger one, I think.
Yep, they do.
Yeah, yeah. Okay, so let's jump into it. We're going to do a Q&A. We got so many questions about progesterone. So I think I'll just read some of them off. Obviously, you and I, some of these questions we've covered before, but they're kind of the stock standard, but we might just touch on them because women are still curious and they maybe haven't come across you before. And for anybody listening, Carol and I have done a previous episode together. So go back and listen to that. I'll put it in the show notes. So let's go for it. Let's see. What can we start with? So many questions. I want to start with this one. Oftentimes we talk about perimenopausal women and midlife women and progesterone. But I wonder if you can answer this one. And we won't spend too much time on it because it's not really the audience. But can kids take progesterone? Like, let's say teenagers and they've got really heavy periods, a lot of cramping, bad PMS. Can they take progesterone?
Absolutely. And that's where I started.
Oh,
Young
okay.
women with severe PMS with very generous amounts of progesterone. And that's why I know large doses work for some pretty severe symptoms. Also, you could put a little progesterone on your baby if the baby's colicky. And children with ADD, ADHD, they have too much adrenaline, progesterone will help that. How much better than to drug your child?
Oh,
Just use a
gosh.
little progesterone to calm them down.
Oh my goodness, I have so many friends who have kids with ADD, ADHD, and then another daughter who has really heavy periods. And this is a game changer. But you're right. What's better, Ritalin or whatever ADHD med, or a bit of natural progesterone?
Right, right.
Oh, that's fantastic. Okay. Could grogginess, you know how people do get groggy sometimes with the oral progesterone, could that have to do with liver support being needed?
It's a good question. So they think that it's allopregnanolone conversion. Way back when I saw one study, there were 10 women, only one got drowsy, and they did measure allopregnanolone was higher in that particular woman. When I worked at Women's International Pharmacy, it was a long time before we even twigged on this, that this was a problem. And we put a warning label, it may cause dizziness or drowsiness, because we didn't see it that much. So rather than say it's so common, I don't think it is so common. But I had an interesting situation where I experienced it for myself. First time in 30 years I've been doing this. So a friend of mine gifted me some progesterone capsules, and I decided one morning to take 250 milligrams. Wham!
Mhm.
So what I did, I had my trainer was coming over. He goes, "What's wrong with you, Carol? You're drunk." I said, "It's the progesterone." And I said, I want to work out, but I have to be really careful because I feel dizzy.
Yeah.
And then I ate 4 eggs and it
Yeah.
was gone.
Wow.
I don't have any of this. If I haven't tried 200, doesn't bother me at all.
Yeah.
So maybe that is one technique that I didn't include before. A smaller dose at a time
Yep.
may not produce as much, and that might be a technique. Otherwise, do non-oral. Less halopregnol seems to be formed with
Mhm.
sublingual, intravaginal,
Yep.
topicals. So
Mhm.
you can switch it around.
Yeah, for sure. And so you don't think it's a liver thing, it's maybe just an individual genetic sort of thing, right?
Yeah,
Yeah.
yeah.
I actually do see that grogginess a fair bit in my ladies.
Mhm.
But it's an easy fix. It's like just switch to the topical or mix up your topical with oral, right? You could do a mixture of both.
Yep.
And funny you should say that. I was thinking about you because when I was in Toronto recently, I was like, I'm just going to take 400 milligrams of oral progesterone tonight. And I had done this before, and I was just sort of playing around. Not people listening, you don't,
Mm.
don't play. Well, I guess it is kind of say we'll get into that, but
Uh-huh.
anyway, I was like, I'm just going to take 400, and oh my gosh, I felt drunk. Like I felt
Mm.
exactly like, yes, I have been drunk before, and that's how I felt. I felt drunk, and I was like, I was thinking of you because I'd heard that story before, and I just had to go to bed. I was
Uh-huh.
stumbling around. I'm like, wow. So yeah,
That's right. I think eating helped
yeah,
metabolize it
metabolize it.
quicker. Yep.
Yeah,
So I really am encouraging women not to have these really big doses
yeah,
all at a time.
yeah.
Spread it out through the day because
Spread it out.
the um the physiology, when you use a dose, it goes up and it goes down. So why would you just have it in one part of your day
Yeah,
and not the other parts of the day?
makes
Um,
sense.
Michael Platt recommends having progesterone at mealtime
Okay.
because progesterone has an effect on your insulin glucose,
Mhm.
positive effect.
Yeah.
So that's one place where you could put it, whether it's oral or whether it's topical.
Interesting. Awesome. Okay, let's talk about heart palpitations, heart flutters. Um, what are your thoughts around these? Do you think it is a progesterone thing? Maybe there's a few different things going on. I understand, but a lot of women get these palpitations and flutters. Are you thinking along the same vein as what I've heard you say before? Is just keep increasing the progesterone? Do you think that's going to help with the heart flutters, palpitations, in perimenopause?
Or eat something, and this is
Yeah,
adrenaline.
right. Oh, you think it's
This
adrenaline? Okay.
Okay, and adrenaline gets released in a big slug
Yeah.
when you have a drop in blood glucose. So
Yeah.
it's the hormone that's going to bring up your blood glucose
Mhm.
quickly. And then a couple other problems happen. One is there are some women who can't get rid of that adrenaline. If
Ah,
you're a poor methylator,
mm,
methylation is the number one detox pathway for adrenaline. That may just linger and you have this steady state of anxiety. Or I've even talked to women, their whole body shakes and just
yeah,
keeps going on and on. They can't get rid of that adrenaline. So it also would help if you would eat something.
yeah.
Now, one of the things when you're in this high adrenaline state, you don't feel like eating. You're in
Mm,
a sympathetic dominant state, and you need your parasympathetic
mhm,
digestion to work for you.
yeah,
Dr. Mercola's got in his newest book, just getting some glucose.
yeah,
And there are products that they designed for diabetics who
right,
overuse insulin to rescue them. And he thinks that that could be one of the possibilities, put some glucose in water and sip it.
yeah,
So it has the advantage of bringing up your blood glucose without having to digest it. So um, I've told a few people I don't have feedback on that. The book is relatively new. It's a new idea with him.
okay, all right, excellent. That's good to know. So really, we're thinking, yes, progesterone can help, right? And maybe the vein of that is that it helps with their blood sugar and helps with the adrenaline dominance. But think about also, if the progesterone isn't necessarily helping entirely, think about eating something, getting some glucose.
Yes.
Yeah.
Yes.
Okay.
To get your glucose up to kind of shut off the valve for the adrenaline.
Okay, excellent. Do you know anything about Gilbert syndrome and progesterone? Like, are there any issues with taking progesterone with Gilbert syndrome?
I don't know Gilbert's syndrome.
Okay. That's okay. Let's move down the list. That's all right. Okay, let's see. Okay, if somebody has a very long, they're in perimenopause, irregular periods, and let's say they have a very long period, but most of it is not the bright red blood, right? Maybe that's for a day, but then it carries on for like 7 days. Do you think this is something to do with progesterone? Do you think because progesterone is secretory as well as holds the uterine lining, which I struggle to get my head around that? But do you think that that elongated 7-day period where it's not really a period, it's more like spotting? What do you think?
Not enough progesterone. So in the luteal phase, you can divide it into 2 parts. The first half of the luteal phase from ovulation for about a week, progesterone works along with estrogen to build a nice cushy layer for the egg to deposit there. When progesterone is at its peak and there's no egg, that's when it starts to become secretory. And we have all this stuff like we're taught that progesterone has to withdraw to bring on bleeding. I know that's wrong. Back from the PMS days, women with severe symptoms could take high levels of progesterone 1, 2, 3 days into bleeding. And some women do have symptoms there. It's perfectly all right to use it there.
Yeah.
When your progesterone is not adequate enough, they call it short luteal phase. It means that it looks like you had an ovulation, but your ovulation really didn't produce enough progesterone to efficiently shed. So you're going to have this draggy on thing. If you were to use progesterone at time in higher doses, you can get better bleeding and a shorter duration. And use the progesterone until you do bleed.
Yeah.
And then think about if your other symptoms are there, take it a couple more days. Or if you're fine when you start bleeding, that's when you can go down to a lower dose.
Sure. And for the record, I know people are thinking like it's perfectly fine to take progesterone in that follicular phase, isn't it? Even if you're cycling regularly, if you have symptoms that progesterone helps, there's no problem, right, with taking that progesterone. And it's not going to stop ovulation, right?
Well, it might.
Might.
It might. So during the follicular phase, that progesterone comes from the adrenal glands. Katerina Dahlman, in one of her books, said don't go above 100 milligrams.
100, sure.
And I'm going to assume that she was talking about intravaginal.
Oh, okay.
I usually say 100, 200.
And that's not going to stop ovulation, though, but if you go higher, it might?
It might, yeah.
Yeah. Okay. All right. So for those who are having a regular cycle, but they have tons of anxiety or can't get to sleep at night, and this carries on in the follicular phase, they shouldn't worry about having 100 to 200 milligrams of progesterone in the follicular phase because it's probably not going to stop their ovulation.
Right.
But also, you got to think, what's worse? Like anxiety and not sleeping, and especially in perimenopause, like if you've had some good robust ovulation in your life, I think you got to weigh up the pros and cons at some point.
I know of one woman who took 400 milligrams a day, divided doses every day for years.
Okay. Yeah.
She stopped for a while, had a baby, went right back to it.
There you go.
And did it for a second baby too.
Yeah, right.
Baby, and she used it as birth control, but it's very unreliable. Because anytime you have stress, you may deplete your progesterone to help you with stress. So we can't really say it's good birth control.
Yeah. And you've heard you say many times for ladies who are taking progesterone, if you're going through a more stressful time, you might want to think of topping up that progesterone. Just, you can cycle your progesterone. You don't have to take the same dose all the time for the rest of your life. Yeah. Okay. Some more questions. Let me see. I've got a lot. How does progesterone help? Well, that's a big question. And how do I know what is enough? How do I know what's enough? I mean, you and I know the answer to that.
I put a blog on my website, and this actually came from a woman named Ray who also had progesterone products and did a lot of research for her personal health. She's passed away now. I do give her credit,
Yeah.
and I intended maybe to reference all of those, but it was too big of a job. But anyway, I have them there, signs
Okay.
of progesterone deficiency. And most women, most men, most practitioners do not recognize all the signs of progesterone deficiency. So, what I'd encourage you to do is maybe go over there, print that out, circle what's bothering you, and then use enough progesterone that it all disappears. That's your
Mhm.
goal.
Symptoms. Symptoms
Yep.
of the guide, right? Because so many people think I got a test, but that's unreliable. Symptoms.
No, we really have a problem. Topical doesn't show up in the serum very well, but if you were to take a saliva test,
Yeah.
it's like sky high. So
Yes.
how do you interpret that?
Yeah.
And then we have our medical associations saying, don't use creams. They're ineffective for protecting the uterus. That's quite a lie. But
Yes.
because oral progesterone can show up in a serum test, they are saying that's a surrogate for protecting the endometrium. I would say that's unreliable, and you have to check anybody who's working with hormones. And this is a concern with unusual bleeding. You should get it checked out,
Yeah.
no matter what kind you use.
Yeah, for sure. And so you just said that testing the progesterone in serum is unreliable, and that's for oral as well as topical. Yeah.
Oral will bring the serum up, but you
Okay.
have to get it. You have to
Mhm.
get it in about 4 to 6 hours after your last dose. If you wait
Yeah.
12 hours, it's gone.
Yeah, well, that's just the thing, right? It's
Yeah.
like how do you know what hormone test to, if you're not aware that when you take the hormone and how what the half-life is and all of this, yeah. So
Yeah,
symptoms are the best guide.
yeah, right, right.
Yeah.
I like some of the tests for a diagnosis
Yeah.
without supplementation, but when you start supplementing and think that test is going to tell you if you have enough or you need more or whatever, it doesn't tell you that.
Yeah.
Your clinical signs and symptoms do.
Mhm. Yeah, 100%. Okay, awesome. I've had a hysterectomy, but have my ovaries. My doctor said I only need estrogen. Is that true?
Your doctor is a barbarian.
Yes, I was about to say it. Say
Say it.
it.
I was trying to think of the worst word I could think of. Um, this comes from Dr. Ray Peat.
Uh-huh.
He
Okay.
recommends that you use prolactin as a measure of your estrogen status. That's a pituitary hormone.
Okay. Right.
In the case of high estrogen effect and low thyroid, and sometimes that is caused by the high estrogen, prolactin will rise. And if it rises, it can also bring up parathyroid hormone, which in turn will just suck the calcium out of your bones.
Mhm.
So these practitioners who are saying you only need estrogen and you need it to protect your bones, they have to have failed their biochemistry and physiology and listen to people who tell them what to do and don't question anything.
Yeah.
It's really horrific. This is a horrific thing to do to women. Uh,
Mm,
and then why did they get the hysterectomy?
exactly. Yeah.
They got the hysterectomy because they've been so short on progesterone for so long.
Yeah.
All of the things that we do these surgeries for are the result of long-term progesterone deficit.
Yeah.
So now we just carry on. And these women are a cash cow for pharma. They're going to
Absolutely.
get benzodiazepines,
Mm.
sleeping aids, blood pressure medication, um, antidepressants.
Yeah.
It's just a horror show, and I can't tell you how
Mhm.
many women suffer with all that. And does any of it help? No. They are
Exactly. They still feel
they
like
are
crap.
still miserable.
That's right. So, yeah, in a word, you need progesterone because it's incredible. All these women still are being told you don't need it if you don't have a uterus. It's not true. It has so many protective benefits for the brain, for the bones, for the breath, for so many places in the body. We need that progesterone.
Exactly.
Yeah. Okay.
Exactly. And the next thing might be a breast surgery because you developed these lumps that
Yes.
had some atypical cells, and now you're being diagnosed with breast cancer on top of losing your uterus because of the treatment.
Yeah. 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 Terrible. Let's see. I have anxiety, night sweats, and mood swings. Will taking progesterone help?
Yes.
Yes. Okay, that's a good one.
I want to just expand. I talked
Yes.
about adrenaline a little bit earlier. I believe that the vasomotor things are more an indicator of insulin glucose swings
Mm,
and shooting out of adrenaline.
sure.
And hot flashes, vasomotor things occur early in perimenopause.
Mhm.
According to Jerry Lynn Pryor, in their perimenopausal years, you have the highest estrogen of your whole entire lifespan, on
Mhm.
top of losing ovulations, and then your progesterone is even lower. So that difference between the two it's exacerbated. Progesterone does help with hot flashes. In fact,
Yeah.
we'll do it right away if you get started. Very quickly.
What's that? Say that again.
It'll do it very
It'll
quickly.
do it very quickly. Yeah, and that's good for you to say because they're, very smart people, and a very common thought is that it is estrogen that causes those hot flashes. So it
Yeah,
could be estrogen, but it could be progesterone. Is that right to say that?
yeah, and I think some of this comes from Premarin,
Oh, okay.
which its original approval was for vasomotor symptoms. But
Right.
Premarin is not only estrogen. I have a paper with 60 distinct steroidal molecules,
Mm,
hormone-like,
mm. Yeah.
that is in Premarin.
Mm.
And about half of them are estrogen-like. There's some progesterone-like, some testosterone-like.
Right. Right.
So Premarin may have some vasomotor effect that estradiol say doesn't.
Yeah.
And it could get us into this problem with that's why people are turning to estrogen because they're so used to Premarin
Mhm.
being used for it.
Wow. Yeah, you definitely turn a lot of the commonly accepted ideas with HRT on their head. Okay. Let's see. Does it really matter if we get she's saying micronized insured tablets. So, the FDA or TGA, wherever you are in the world, approved the Prometrium, I guess, or compounded. So do you think it really matters? Like obviously the Prometrium can come with some additives that aren't so lovely, but
Right? Some dyes and peanut oil.
yeah,
Why they would choose peanut oil.
I
A,
know.
a
Yeah.
PUFA, which
Yeah.
interferes with your hormone milieu.
Yeah.
And then it's the same progesterone. We get it from the
Yeah.
same place.
Yeah.
Same
If that's all
imported.
you can get, it's better than nothing.
It's the same thing,
The
whatever.
same
But
thing.
if you have to use Prometrium, yes, it's better than nothing.
It's better than nothing. Yeah. You just got a little bit of those additives, but
Yeah.
okay. I mean, God, we get so many chemicals in our world, so you want to try to reduce it, but if it's all you can get and if it's cheaper, then it's fine. Let's see. Starting to get conflicting information about only being on progesterone and not estrogen as well. Safe? Question mark. So I suppose she's saying, is it safe to just be on progesterone without estrogen?
Yeah. For
Yeah.
when you first start having symptoms, you
Sure.
don't need any estrogen. And that's one of the problems. Doctors are over estrogen
No, I think.
people, and they're going crazy. And
Yeah.
now they're going for the drugs too. They have high anxiety.
Mm.
You may not need any estrogen to after menopause.
Really?
Peri may be just fine. But you have to, I say, look for these symptoms. You want your vaginal tissue
Exactly.
has to be
Mm.
juicy and healthy.
Yeah.
And then you don't want recurrent urinary tract infections.
Yeah.
Estrogen can help with that. Your breasts, you look at your breasts, they become droopy if your
Mm.
estrogen is way down. So if you
Interesting.
lots of breast plumpness, you can say, oh, I'm a little low on estrogen now. Maybe I would like some.
Yeah.
So
Yes. And like dryness, would that be right?
the
Dry
vaginal,
mouth, like dry skin, dry vagina, when you start to get dry, achy joints, things like this?
Okay, some of the skin dryness, you've got to think thyroid.
Thyroid, yep.
But Dr. Terry Hertog um, he's from Belgium, and he's talked about hormones many times in the US. And he's got this lovely book, The Hormone Handbook.
Okay.
And the Hormone Handbook and how he teaches is that you can look at somebody and virtually diagnose them from how they appear.
Wow.
And one of the things he says about a lack of estrogen, progesterone, and testosterone in your hair, he said you get flat hair.
Flat hair.
Flat hair. He said, look at pictures of young girls and their hair is bouncy and
Yeah.
shiny. And then when you get this flat drab hair, that is low sex hormones.
Oh, wow. I'm getting that book. That's interesting. That's interesting. Okay, let's see. Okay. How to tell if I'm progesterone intolerant?
You're probably not.
Yeah.
And you've probably been given a little dose of progesterone, and you probably provoked excess estrogen activity. And I'm thinking now excess adrenaline, because women do get this heart pounding and they run to the emergency. Women who take 20 milligrams of progesterone can end up in the hospital thinking they're about to die. You've provoked that with too little. And it's especially a problem when women had a long history of not enough progesterone and you put just a little bit in, you're asking for trouble.
Yeah.
So I say go immediately to 300 or 400 milligrams of progesterone if that's the case for you. I just talked to somebody, she said her doctor, naturopath, gave her progesterone 25 milligrams and she felt like crap.
Yeah.
And the naturopath says, see you in 3 months.
Oh, yeah.
And she did her best to put up with it. This is a dangerous situation.
It is.
This is not healthy. Don't put up with it.
No.
You should not feel like this.
Yeah.
For progesterone, if you've been pregnant, and for most women, albeit not all, when you're in your 3rd trimester of pregnancy, you felt wonderful. I felt like I could be pregnant forever and I would be just fine. And many of my clients are saying, "Oh, the only good time in my life was when I was pregnant,"
Yes.
because they had larger amounts of progesterone. And that's what progesterone should feel like. If you have anything less, you need to take more and do it very fast.
Yeah.
Every 15, 20 minutes if you need to. Headaches disappear, the anxiety disappears. Talked to one woman, had a couple doses of progesterone. She said she was up all night peeing. She had so much water retention and it took
Oh, that happened to
it
me.
off. Yeah.
So hold on. Okay. Good things here. So the headaches. So premenstrual migraines that occur maybe one day a month when estrogen dips, typically. I personally have had experience with these, and I believe it's the estrogen. I just used a little bit of estrogen in my luteal phase that took these away. Now, that was good for quite a while, and then it stopped working, but I kind of played with things. So I guess I want your thoughts around headaches and migraines. Do you think estrogen has a place or do you not? And do you think it's progesterone? And then the nocturia, that peeing at night, that absolutely happened to me. And it was problematic. But when I did bring the progesterone down, and albeit I don't really have symptoms, it's that premenstrual migraine that sometimes comes and sometimes doesn't. But that nocturia was a real problem. And I brought the progesterone down. It definitely sorted that out. So thoughts about any of that?
Or you've been peeing for long enough that it was no longer so critical an issue. Might also have been in play there. Yes, estrogen can take care of a headache. There are low estrogen headaches.
Yeah.
I would say by far and large, I run into progesterone being the one that's most needed. But if progesterone doesn't work, then do try estrogen.
Yeah. Okay. Good to know. All right. Let's see what time it is. All right. So is there a threshold to reach with progesterone to get rid of migraines? taking 400 have rubbed cream and then it stopped. So yeah, I guess to your point, it's one of those things, right? But is it an estrogen thing or is it a progesterone thing? And yet,
Right.
to her point, should she keep going up? She's at 400. At what point? And I guess it's also when the headaches or migraines occur as well in the cycle.
Right. Right. Right.
Mm.
So, if you think it's progesterone, 400 is not particularly large. I double it, triple it easily if that's
People will be going,
your.
wow.
I know.
So 800, 1200 milligrams.
Yeah, that might do it.
But maybe not orally because,
Yeah, right.
whoa.
It's easy. Yeah, it's easy to do the cream. And
Yeah.
often with a headache where progesterone's involved, you get a stiff neck and shoulders.
Oh,
You put
okay.
progesterone there and it immediately relaxes. So
Right.
that might be another clue, like when you want to use
Mhm.
progesterone. But I
Okay.
definitely know of cases where estrogen is the thing. Little
Yeah.
sublingual estradiol, bang, the headache goes.
Absolutely. And, when you look at the mechanisms when it comes to these migraines around the premenstrual cycle, and you look at the triptans and how they work, it kind of makes sense then that if the triptan works for you, correct me if I'm wrong, you're the pharmacist, but I would assume, does it make sense if a triptan's working, it's probably more an estrogen thing?
I don't know.
Don't know.
I
Yeah.
haven't studied that up. I
Okay.
would I would um, refer you to Dr. Jeff Baker.
Jeff Baker. Okay.
And I just got reconnected with him on Substack.
Yep.
He had been a very, very big prescriber at Women's International Pharmacy when I was there. And he has just put together a natural treatments of migraine headache
Okay.
program on his Substack.
Interesting.
And
Right.
he covers both
Okay.
estrogen, progesterone,
Awesome.
and he has a course, a self-guided course
Fabulous.
for people with migraine to
Great
explore.
tip.
He's
Thank you.
his point, and probably why I was reluctant to answer your question. It's multi things.
Yeah.
Um,
It's not black
it,
and white. We wish it was.
right, right. It may be progesterone, might be estrogen, it might be something else
Yeah.
entirely. So
Yeah.
then
Yeah.
you keep
Fascinating.
looking. But he's a prince of a man, an excellent piece of work on his Substack.
Great. Thank you for that. Okay, so this lady says, I'm afraid of it causing depression. Is this true? And this goes back to maybe using too low of a dose. But this is a common thing, like women who might start to dose on progesterone and get a bit of a low mood. And oftentimes in the HRT circles, we're taught that, yeah, too high progesterone, one of the symptoms of having too much is depression.
I'd look somewhere else. It might be that estrogen is lower,
Yeah.
and you might need a little estrogen. The other really big thing you should look at is thyroid.
Thyroid.
Huge amount of um, depression tied up with thyroid.
Yep. Yep. Hot tip. Let's see. Been taking progesterone every day without estrogen. I mean, obviously, we need more information from these people. We don't have it. And didn't get a period this month. Is this normal? We've kind of covered that,
No
you can.
ovulation, no period.
No ovulation, no period. Yeah. So it depends on the dose, it depends on how old she is, etc. But when people, correct me if I'm wrong, but like when ladies start to take HRT, they're messing with their hormones in a wonderful way, but you can expect your period perhaps to go a little wonky, right?
Yeah.
And
Yes.
that's okay. It's not
Yeah.
necessarily a bad thing, right?
It's okay, and progesterone really is quite notorious for you're putting it in the luteal phase. It might shorten up a bit, it might lengthen a bit,
Mm-hmm.
um, and you may or may not have an ovulation. If you don't have an ovulation, that's it, what you put on. If you have a ovulation, you have tons more, which is
Yeah.
delightful.
Yeah, exactly. Okay. To cycle or not to cycle in peri? Well, I think we've kind of covered that. It depends on the
Your
individual.
decision. I like to cycle with women still cycling.
Yeah, makes sense, doesn't it?
Yeah.
But
Yeah.
then in menopause, no more cycling. You just take it every day.
Right. Now
Yeah.
you're really in adrenal pause.
Right.
Because when your ovaries are finished, it's up to your adrenal function to
Mm,
do all your sex hormone and adrenal hormone functions.
mm.
And when you hit the wall, that's when you have adrenal pause. Your adrenals aren't there for you.
Yeah, right.
About 80% of women hit the wall.
Mhm.
Horrible.
Yeah, absolutely. Well, this society we live in doesn't help, hey?
No.
Yeah, stress. Okay, let's see. Is sorry, we'll skip that. We've covered that. How to know if you have a proper estrogen to progesterone ratio in perimenopause if experiencing weight gain after starting on HRT? It's a bit
Okay.
need more
All
information.
right. First of all, I hate that word ratio
Yes.
because so you're measuring somehow in perimenopause, outside of having probably generous estradiol, it swings around all over the place.
Yeah,
So why would you base a decision on something that swings around like that?
good point.
But symptom wise,
Yeah.
that's telling me estrogen is dominant, not enough progesterone. You estrogen being more dominant, you're going to have more fat storing in the fat cells. You're going to have more fluid retained, and on top of that, it's going to drop your metabolic rate with the thyroid when
Yeah.
estrogen's in excess. So
Yeah.
it's got to be corrected. Progesterone will help with that.
Yeah, progesterone very much supports the thyroid, doesn't it? Whereas too
Right,
high of estrogen can really inhibit thyroid function. So
right, right.
maybe don't look at the estrogen to progesterone ratio. Maybe that's the wrong way of thinking. Look at the
Mhm.
thyroid. Maybe try more progesterone. Look at your symptoms for low progesterone. Yeah. A big common question is GI symptoms with progesterone, right? So some people do tend to get constipated or bloated or heartburn. So what are your thoughts around that and what to do?
That's the bane of my existence.
Yeah, 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 I'm sure.
So that turned out to be one of the things when women were taking high doses for PMS.
Mhm,
Things like that, and stomach things, and sinus things, and irritable bladder, all
yeah,
kinds of things that can be candida related.
right.
And candida, if you're already overgrowing candida, I found two ways that progesterone could increase the growth of candida because it seems to do that if it's already overgrowing.
Mm,
One is candida makes your blood sugar drop.
yeah,
Progesterone's bring it back up. Candida's got more to eat.
yeah,
And a fed candida colony can grow hundreds of times in a day. Just think
right.
about it. And then uh, there are, I never memorized it, but there are some immune proteins that are suppressed by progesterone. And these proteins are suppressed because this allows you to carry a foreign body, your
Mhm,
baby.
yeah,
And that also, because that's part of your immune system, candida can take advantage of that suppression and
mm,
and overgrow. So you really have to get a
mm,
foothold on that candida. One of the things I sometimes do is I recommend pregnenolone instead of progesterone. It's
mm.
a it's a little less volatile with this candida thing, so maybe start there.
Fascinating, okay. And do you have a test that you like for candida? Like, can you do the, antibody blood tests? Do they are they reliable?
You can, but I don't really know. I was going to maybe try using organic acids,
Oh, okay, yeah,
which they have the organic acids excreted by these organisms.
yeah,
I don't know if it's open and shut.
mhm, yeah,
It's
but
a real problem.
yeah. So do you think, constipation with progesterone would be a candida issue, or do you think that might be separate?
It might be, and so might diarrhea, same for the same reason.
Okay, alright.
Okay, but
Fascinating.
constipation is a red flag for low thyroid with or without
Yeah.
progesterone. So
Yeah,
always think about that.
thyroid, yes. Can I take progesterone while on birth control?
No,
No.
you're spitting in the ocean.
Ah, right. Yep,
It's
yep.
it's not gonna be effective, and we actually tried, um,
Okay.
to relieve some PMSy kind of symptoms that, women had while they were on birth control pill. Doesn't touch it.
Why is that though?
You're blocking the receptors.
Blocking the receptors, oh,
Yeah,
right.
yeah.
Oh, goodness. Yeah, wow, okay. All right, let's see. I take 100 milligrams oral and 35 cream at night, and I'm still not sleeping. Should I increase? Well, the answer to that is yes, yes, yes. That's a
Yes, yes.
small dose, isn't it? 135 milligrams. That's a tiny dose, really, if you're
Yeah,
having
really.
sleep issues.
Yeah.
Yeah.
Yes.
Up till you sleep, right? Um, can you take it every day? We've answered that. Have you seen benzo type withdrawal from progesterone before?
No,
No.
but I do have a concern with benzos, and
Gosh,
it
yes.
came to me when I was working with a young woman with seizures,
Okay.
and why I was really concerned because her doctors load her up on benzos
Oh.
as anti-seizure medication.
Mm.
She was using 600 milligrams of progesterone, and all her PMS, which was severe pain with her period, just disappeared. All of the seizures at that point had not, and then she developed some other things. So I'm not quite sure where we are. But one of the things I did, because benzos work at the GABA receptor, so does progesterone, and I was concerned that all this GABA receptor stuff, and I was also concerned with her because there's more drugs than just work at the GABA receptor. Why were they loading up more and more and more? And then I found something interesting. If you are cholesterol,
Yeah.
low cholesterol makes your GABA receptor less sensitive. And I found
Mm.
some cases of some very sick women, one man, really low total cholesterol. You
Mm.
can't make your hormones, you can't repair your body.
Yeah, no, you need
And
that
so now,
cholesterol.
and then maybe progesterone is not going to work as well because the GABA
Mm.
receptor is not as receptive.
Right. Wow. Interesting. Interesting. Yeah, cholesterol's a whole rabbit hole, isn't it? We
Yeah.
could statins and we could go down that one. Can you take progesterone while breastfeeding?
Yes, and you can take some. And I was just asked that question. I don't know the answer for how much
Yeah, sure.
because I mentioned the hormone prolactin,
Yeah.
and that goes up and it helps you produce breast milk.
Yeah.
Progesterone counters it.
Right.
So there's really no danger to your baby having progesterone. We talked about that earlier. Young
Mhm.
babies can have progesterone, but I think you should be leery about using too much progesterone that you may block your prolactin and stop the breast milk.
Right.
So there's that there's that issue. On the other hand, what if you've got postpartum depression and you're really, really in bad shape?
I
I
could
would
have done with
say,
some progesterone then.
yeah,
Yeah.
I
Yeah.
would say go for the progesterone.
Yeah,
Mm.
absolutely. Yeah. Okay. How can I overcome a negative reaction? We covered that in the first episode, and we kind of touched on it. So go back and listen to that. Whoever's asking those questions. What would I gain by taking progesterone without estrogen? And can you do that? We've kind of covered that. You'll gain a lot, but maybe estrogen comes on board later in menopause.
Yes.
When to know if it's working best? We've covered that. What is the best dosage to protect against endometrial cancer if somebody's using estrogen? But that's kind of not a black and white answer, is it? That's why you
No,
say we do a vaginal ultrasound.
you don't want to build up the endometrium.
Yeah.
And this is really kind of an interesting thing. I think it was University of California, maybe San Diego, maybe Irvine. These people produced a study, and what they said with endometrial cancer is as the cancer progresses, your progesterone receptors, the numbers decline.
Really? Wow.
Yeah, and they were proposing that they would create a test for you so you could see how bad your cancer was.
Wow.
However, in the introduction, and reference to somebody, they said before about 50% of endometrial cancer was successfully treated by progesterone. So why don't we try that first instead of rush to the hospital and take out your uterus?
Uh-huh.
I really don't know.
Yeah, exactly. Far out. Yeah.
I did have this. So Quicksilver Scientific has this serum, a nano emulsion,
Mm.
and this doctor um, contacted us or contacted me because I'd just been at their conference, And they had a young woman with stage 4 endometrial cancer coming to their clinic. So this doctor does all sorts of support stuff, metabolic support, ozone, what have you.
Yeah.
We donated probably a big pint of progesterone, and it was 8 milligrams per mil. The doctor told his patient to use a tablespoon. So in the end, she only got 120 milligrams. But in the time she was there, probably 5, 6 weeks later, she was down diagnosed to hyperplasia.
Wow. Wow. Okay. So I guess at the end of the day, progesterone will work, but it really depends on the individual, I guess, right? And you've got to do those transvaginal ultrasounds if you're on that estrogen, don't you?
Yeah.
Yeah. Okay. Let's see, a lot of the same. So somebody spotting day 21 to 25 ahead of their period, that's usually used more progesterone.
Yes, you're getting
Yeah.
inefficient. You could have low estrogen or you could have high estrogen at that point. Low estrogen can make a very unstable endometrium and cause some.
Okay.
And then
Okay.
and the high built up endometrium, you may be spotting because you got some progesterone effect, but not enough to completely clear it out.
Okay. And so people are thinking in their heads, well, how do I know? And this is where you go back to your symptoms, right? And you really need to look at, well, what are the symptoms of high estrogen? What are the symptoms of low estrogen? What are the symptoms of high progesterone, low progesterone, da, 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 da. Yeah. And it does get a little tricky for people who aren't in the industry, but those symptoms are going to be the best guide at the end of the day.
Mhm.
Yeah. But you know, it really sounds like playing with your progesterone, it's not harmful. Correct me if I'm wrong, the worst that can happen is you'll feel drunk like I did and you'll go to bed like you did.
That really is the worst, that you
Yeah.
didn't feel so good. Or if you had too little and you had palpitations and
Sure.
stuff and didn't know to take more.
Yeah, yeah, that could be quite scary. Okay, we'll wrap it up. Let me just see. Does it increase risk for cancer? Why does my product say it does? That's the labels in California. Good old California.
Yes,
Those scary labels on everything.
I have some experience with that, of the
Okay.
top 65,
Yeah.
and this woman contacted me, and she wanted to get rid of that labeling. So I obtained the 80 studies that they relied on to put that cancer warning on in California.
No.
None of the 80 studies were done with progesterone. All progesterone. Zero.
You're kidding. With progestins, all done with the synthetic progestins, which we know are
Yes.
bad news.
Yes. So we asked California to reevaluate, and they refused.
Of course. They're California.
This is-
We go there.
Yeah.
Wow. Okay. So no, it doesn't cause cancer. Progesterone, natural bioidentical progesterone is good for you, safe for you, doesn't cause cancer. End of story. Yeah.
Right. So I again want to emphasize that if you have something that's really an estrogen burden, like a fibroid or endometriosis, the worst thing you can do is use too little. You really have to get way up, or you're going to cause those things to grow.
And that's a very good point. And maybe we'll end on that because I think we've covered most of these questions. But a lot of people ask, can I do hormones if I've got endometriosis? And, you know, if you've got endometriosis, that is something that you really need to be taking progesterone very seriously and dosing it high enough, right? Especially
Right.
if you're going into perimenopause, you do have symptoms of low estrogen and you need estrogen. But if you've got endo, that progesterone becomes vital in the right amounts. Yeah.
Right, right. It has to be generous. So the other thing about endometriosis, it's also related to candida. William Crook wrote a book, The Yeast Connection in the Woman. He's got a lot about that in there. And just recently, I don't know if this was a good reference or not, Instagram. I don't know if it was. But it kind of astounded me. So this doctor said, in the case of endometriosis and fibroids, look for a vitamin D deficiency.
Oh, okay. 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 Good to know. Good to know. All right, Carol, those are the questions. We've been going for a while, and I think we covered some good ground there. So I just want to thank you again so much for being here and sharing your wisdom.
Thank you. Tim.
You
It's
are a
my
hot
pleasure.
commodity at the moment. You are a hot commodity.
I
And I
know.
appreciate you. Tell everybody, we'll put it all in the show notes, but just tell everybody where they can find you.
Okay, the wellnessbydesign.project.com is my website. And then I have this, by the same name, I have a YouTube channel.
Fantastic. We will put that in the show notes.
Okay.
Thank you so much, Carol. And
Oh,
who knows,
thank you,
maybe
Karen.
we'll speak again soon. Bye for now.
Okay, bye.